Assalamu alaikum wa rahmatullahi wa barakatuh. English for non-subject specialist of the medical college, the first semester. Welcome everybody to class number 4. Today we are going to talk about the parts of the body. And after we finish the parts of the body, we are going to talk about some, issues related to the respiratory system, and of course the issues related to the respiratory system. Now let's start with this third part, talking about parts of the body. And as usual, we are going to deal with the listening, and of course after the listening we are going to answer the questions related to this topic. First thing first, we have this issue. So we have the patient, and we are going to listen to the record first. One. Number two, we have what are the parts of the body do not involve the senses. So the senses, we have 5 senses, of course. So we have the sense of vision or seeing, so we can see; the sense of hearing, so we can hear; the sense of smell, so we can smell things and aromas and odors; and of course the sense of taste, where we can taste things, okay, when we eat, or even so the taste and smell are linked together. Okay. Now let's listen and answer the questions. Before we answer the questions, then we are going to choose the choice questions. First, we have this patient assessment card. Let's listen to it. Then after that, we are going to answer the questions related to it. Listen, please.
Unit 6, Parts of the Body 3. Exercise 5, page 15. Patient assessment. Name, Molly Roberts. Sex, female. Age, 14. Primary physician, Dr. Joseph Nelson. Parent guardian signature, Pamela Roberts. Home phone 555-8889. How did injuries occur? Bicycle accident. Describe injuries. The patient has no severe head trauma. There are minor scrapes on the face and a small bruise on her jaw. The patient has one deep cut on the forehead. There are 2 minor cuts between the right eye and eyebrow. The nose appears bruised and the upper lip is bloody and swollen. There are scrapes on her left cheek near the left ear.
Okay, now we are going to listen again and answer the questions. Number 1, what is the purpose of the document? A, to list the patient's medical history. To report where facial injuries are located. C, to explain how to treat the patient's injuries. D, to describe how the patient's injuries have healed. So this is question 1. Number 2, the patient has injuries in all of the following areas except her cheek, her jaw, her head, her lips. Which body parts are bruised? Eyebrow and jaw, nose and jaw, cheek and nose, cheek and ear. So we are going to listen again. Then after that, we are going to answer the questions 1, 2, 3. Listen again.
Unit 6, Parts of the Body 3. Exercise 5, page 15. Patient assessment. Name, Molly Roberts. Sex, female. age 14. Primary physician, Dr. Joseph Nelson. Parent, guardian signature, Pamela Roberts. Home phone 555-8889. How did injuries occur? Bicycle accident. Describe injuries. The patient has no severe head trauma. There are minor scrapes on the face and a small bruise on her jaw. The patient has one deep cut on the forehead. There are two minor cuts between the right eye and eyebrow. The nose appears bruised and the upper lip is bloody and swollen. There are scrapes on her left cheek near the left ear.
Okay, so for the first question, what is the purpose of the document? Number A, to list the patient's medical history, to report where facial injuries are located. C, to explain how to treat the patient's injuries. D, to describe how the patient's injuries have healed. So the first answer, yes, it is number B. So number B is to report where the facial injuries are located. That's the main aim of the report. 2, the patient has injuries in all of the following areas except one area: her cheek, her jaw, her head, her lips. Yes, so her head was the only area which was not injured. Which of the body parts are bruised? A, eyebrow and jaw. B, nose and jaw. C, cheek and nose. D, cheek and ear. So the parts of the body which were bruised are the nose and the jaw. Now we have the matching questions. We have vocabulary, we have lips, face, forehead, cheek, head, ears, and finally eyes. So the lips go with, let us just make this little bit bigger. Yes, so for the lips, number 1, lips goes with the word lips goes with D. D, the sensitive organs surrounding the mouth. 2, face goes with E. E, the front part of the head that contains the sensory organs. And forehead number 3 goes with B. With number B, the part of the face above the eyebrows and below the hairline. Number 4, cheek. Cheek goes with F. So F is the fleshy part of the face on either side of the nose. Then finally, before final is the head. Head is C. The body part that contains the brain and skull. Ears go, the word ears goes with number A, the organs that detected sound. So sound goes with ears. Finally, eyes is G, and the organs that detect sight or vision. Okay, so these are the simple, we say 7 parts of the face, the human face. And we are going to deal with the, we say, other vocabulary or other issues related to the parts of the body, the face. Now, check the sentence that uses the underlined part. So the forehead, exercise 4, number A. The forehead is the bone that holds the teeth. So Is it true? The forehead that holds the teeth? No, this is wrong, of course. The man plugged his nose to avoid the bad smell. So we plugging means closing, shutting the nose to avoid the bad smell. Yes, so this is true. The eyebrows keep water out of the eyes. The eyebrows keep water out of the eyes. Yes, so this is true. Sarah couldn't hear well due to her lip injury. So hearing with lip, there is no connection. So this is wrong. Number 3A, the dentist opened Carl's mouth to look at his teeth. So the dentist, yes. Mouth, yes. Teeth. So dentist, mouth, and teeth, yes. This is true. Mary opened her cheeks to see what was happening. Mary, we don't say opened her cheeks. So you can't open cheeks anyway. So this is wrong. Now, in the next part, in the next part, we are going to listen to a conversation between a nurse and doctor and the doctor, then mark the following statements as true or false. So let's just make this a little bit smaller. Yes. So number 1. The patient has scraps below the lips. The patient has no injuries on her forehead. The wound near the patient's ear may be a serious injury. So let's see if these things are true or false. Let's listen, then answer the questions.
Exercises 6 and 7, page 15.
Hi, Dr. Stevens. I just saw the patient in room 7.
Ah, yes. How is she doing?
She has several facial injuries, most are just scrapes.
Okay. Where are the scrapes exactly?
There are a few above the left eye.
Above or below the eyebrow?
Above the eyebrow, on the forehead.
I see. Is that all?
No. There is a deep wound near her left ear that looks serious. She may need stitches.
Thanks, Ben. I'll take a look.
Okay, now listen again.
Exercises 6 and 7, page 15.
Hi, Dr. Stevens. I just saw the patient in room 7.
Ah, yes. How is she doing?
She has several facial injuries, most are just scrapes.
Okay. Where are the scrapes exactly?
There are a few above the left eye.
Above or below the eyebrow?
Above the eyebrow, on the forehead.
I see. Is that all?
No. There is a deep wound near her left ear that looks serious. She may need stitches.
Thanks, Ben. I'll take a look.
Okay, for the first question, the patient has scrapes below the lips. So it's not below the lips. It's over the eyebrows. So this is false. Number 1 is false. 2, the patient has no injuries on her forehead. This is again false. She has injuries. And final, the wound near the patient's ear may be a serious injury. Yes, this is true. And she needs maybe some stitches. Now, we are going now to listen again and fill the missing words as usual. So we have some missing vocabulary that need to be written in the gaps. Okay. Yes, now let's look at number 1. Listen and answer the questions.
Exercises 6 and 7, page 15.
Hi, Dr. Stevens. I just saw the patient in room 7.
Ah, yes. How is she doing?
How is she doing? How is she doing?
She has several facial injuries. Most are just scrapes.
She has several facial injuries.
Okay. Where are the scrapes exactly?
Where are the scrapes exactly?
There are a few above the left eye.
Above?
There are few above the left eye.
Above or below the eyebrow?
Above the eyebrow, on the forehead.
I see.
Okay, so above or below. Above or below the eyebrow. Above, yes, above the eyebrow, on the, yes, on the forehead. Yes.
See. Is that all?
No. There is a deep wound near her left ear that looks serious. She may need stitches.
Thanks, Ben. I'll take a look.
Okay, there is a deep wound near her left ear that looks serious. She may need stitches. Okay, so this is what we have for the language of, we say, the face, or the parts of the human face. Now we are going to the speaking part, the language part. When you want to ask a question about, let's say, the usage of the language, or how to use the language appropriately, so we are going to say, to ask about the patient's condition, for example, you say, how is she doing? How is he doing? So here, how is he doing? How is she doing? Doesn't mean I'm asking about his job or what is he doing. No. How is he doing? That means his health condition. Is it a serious condition? Is it a normal condition? Are the wounds serious, for example? Or are things getting worse? So you are asking here about the patient's condition. So this is very important questions. So then when you have to describe, you have to say she has, let's say, where if she has some scrapes over the face, or she has a wound, let's say, as he said here, behind the left ear, so a deep wound. So he said she has, yes. Then if you want to have a summary, you say, is that all? Is that all? So when the nurse described the condition of the little girl, when he finished, she said, is that all? So is that all means have you finished? Is that everything? So this is what we have. So here we have, how is she doing? This is a present continuous, but I'm not talking about the job, but I'm talking about her condition or the patient's condition. So when we, so if you are a doctor and you want to ask about the patient's condition, so you have to ask first about the condition. How is she doing? How is he doing? If everything is okay, not a dangerous issue, no trauma, nothing. So you can ask the rest of the questions to describe where the injury or injuries are. In the patient here, in the description, so describe injuries of the following parts. Head, so you can say they are scrapes or scratches, or we say a wound, a minor wound, or a deep wound on the head, face, eyebrows, eyes, forehead, jaw, cheek, nose, ears, and mouth. So this is like a report when you write about the injuries of patients. So the language is not very difficult. Sorry, language is not difficult, but you have to be precise. So it's not only the face. So we have these 7 or 8 parts of the human head. Okay, now let's move to another part about one of the diseases that occur or happen to human beings. And this issue or these diseases, they affect the system that we use it for breathing or the respiratory system. Of course, the respiratory system consists of different parts from the body, as you can see from the photos in front of you. So we have, they start from the nose, the mouth, and then we go to the major part, which is the lungs, and of course, the minor parts in the lungs themselves. Okay, now we have these, we say, issues. Now we are going to listen again, and we have these, we say, we read the questions. What are some parts of the respiratory system? What are some common elements of the respiratory system? So we have, of course, because this system is, we say, in touch with the air, which is part of our body, which is exposed to the atmosphere. The skin, of course, the skin and the respiratory system, they are exposed to the changes that happen in the atmosphere, which is, of course, any change or any changes happen in the weather, in the air, we say condition, things that happen during the winter, the summer, these changes affect us negatively or positively to our, we say, health. Now, before we go to the reading, I want you to look at the questions related to the listening. What is the main topic of the passage? What is the main topic? Which of the following is not a symptom of asthma? And then when do alveoli lose their shape in a person with emphysema? So we are going to listen first time, then we come back again to the questions, listen again, then we answer these questions. So let's listen to the two parts of the listening today, the asthma and the emphysema. Then after that, we are going to answer the questions concerning the respiratory system.
Unit 7, Respiratory System. Exercise 5, page 17.
Hyde's Medical Dictionary. Illnesses of the respiratory system.
Asthma. Asthma is a chronic disease of the lungs. It involves inflammation of the bronchial tubes and other airways. This causes wheezing, coughing, and difficulty breathing. One way to treat asthma is to inhale medicine using an inhaler. Emphysema. Emphysema is a progressive respiratory disease. It is the result of bronchial tube damage. In emphysema, the alveoli lose their shape and functionality when the person exhales. As a result, less oxygen is allowed to enter the bloodstream. Smoking tobacco is one of the most common causes of emphysema.
Okay, so we have listened to this. Now let's read the question. What's the main topic of the passage? Comparing treatments of respiratory illnesses. B, defining two types of respiratory illnesses. C, categorizing parts of the respiratory system. D, explaining how oxygen enters the blood. 2, which of the following is not a symptom of asthma? Wheezing, coughing, inflamed bronchial tubes, excessive oxygen entering the blood. Number 3, when do alveoli lose their shape in a person with emphysema? When the person exhales, when the person inhales, when bronchial tubes become inflamed. D, when the person takes medicine. So let's listen again, then answer these questions in turn. Listen, please.
Unit 7, Respiratory System. Exercise 5, page 17.
Hyde's Medical Dictionary. Illnesses of the respiratory system. Asthma. Asthma is a chronic disease of the lungs. It involves inflammation of the bronchial tubes and other airways. This causes wheezing, coughing, and difficulty breathing. One way to treat asthma is to inhale medicine using an inhaler. Emphysema. Emphysema is a progressive respiratory disease. It is the result of bronchial tube damage. In emphysema, the alveoli lose their shape and functionality when the person exhales. As a result, less oxygen is allowed to enter the bloodstream. Smoking tobacco is one of the most common causes of emphysema.
Okay, so for question 1, what is the main topic of the passage? It's number B, defining two types of respiratory illnesses, the asthma and the emphysema. 2, which of the following is not a symptom of asthma? It's excessive oxygen entering the blood. It is D. So these are, this is one of the symptoms which is not symptoms of asthma. Number 3, when do alveoli lose their shape in a person with emphysema? When the person exhales. So this, when exhales, that means when the person in the breathing, so they lose their shape, so which reduces taking the oxygen anyway. So to the body, of course. Now we go to the vocabulary. So we have asthma, lungs, bronchial tubes, exhale, and oxygen. Number one, air passes into the lungs from the trachea through the bronchial tubes. This is number 1. 2, Sam's makes him cough and wheeze. So Sam's asthma. 3, emphysema makes it difficult to exhale. Number 4, the lungs are the main organs of the respiratory system. 5, the last one, is naturally occurring gas essential to human survival. The oxygen is the main, of course, gas for us as human beings or living beings. Oxygen is a naturally occurring gas essential to human survival, of course. Yes. Now, this is the first part of the class. So now we go and finish the rest of the vocabulary related questions, and let's look at the question number 4. Question number 4. Write a word that is similar in meaning to the underlined part. So we have to treat Jane's asthma. The doctor gave her medicine to breathe in. Breathe in means inhale. Inhale. Good. 2, people with respiratory illness often find it difficult to inhale and exhale. Exhale, so inhale, exhale, it means breathe. Three, small air sacs in the lungs are the endpoints of the respiratory airway. So this is yes, they are alveoli. 4, the patient suffers from damaged and misshapen alveoli is called emphysema. The network of organs and airways responsible for gas exchange can be adversely affected by smoking. So this is called the respiratory system. Now, in the next part, in this coming part, we are going now to listen to a conversation between a doctor and patient. So we are going to mark the questions as true or false as usual. So before we listen, I want you to read the questions. The woman has had asthma for years. The woman's illness is curable. The man writes the woman a prescription. So this woman has had asthma. So we are going to talk about in the grammar part today about the present perfect, and we are going to deal with the present perfect. What does it mean? How it works? So this is very essential. So, but present perfect links the past with the present. That's why you need it when you ask about the history of a patient. Now let's listen. Then after that, we answer the questions as they come in turn. The woman has had an asthma for years. The woman's new illness is curable. The man writes the woman a prescription. Listen, please.
Exercises 6 and 7, page 17.
Good morning, Mrs. Simmons. I've taken a look at your chest x-rays.
Yes? And what did you find?
I'm sorry to say it appears to be emphysema.
Oh, really? I thought it was just my asthma.
Well, you've had asthma for years, but this is an entirely new condition.
Can it be cured?
Unfortunately, emphysema is incurable, but there are treatments that can slow its progression.
I hope they work. I just want to be able to breathe well.
Listen again.
Exercises 6 and 7, page 17.
Good morning, Mrs. Simmons. I've taken a look at your chest x-rays.
Yes? And what did you find?
I'm sorry to say it appears to be emphysema.
Oh, really? I thought it was just my asthma.
Well, you've had asthma for years, but this is an entirely new condition.
Can it be cured?
Unfortunately, emphysema is incurable, but there are treatments that can slow its progression.
I hope they work. I just want to be able to breathe well.
Okay, so for number 1, the woman has had asthma for years. Yes, she has this chronic disease. So yes, this is true. The woman's new illness is curable. The woman's new illness is curable. No, unfortunately, he said, unfortunately, it is incurable. The man writes the woman's prescription. No prescription in her case. So this is false. So number 1 is true. Number 2 is false. Number 3 is false as well. Now we are going to listen to the whole conversation again, and then we are going to write the true or false. We say to follow the questions if they, to fill the missing gaps of the conversation. So I want you to listen and answer the question, the missing words as they come in turn. Listen, please.
Exercises 6 and 7, page 17.
Good morning, Mrs. Simmons. I've taken a look at your chest x-rays.
Yes? And what did you find?
Yes, and what did you find? Okay, so
I'm sorry to say it appears to be emphysema.
I'm sorry to say. I'm sorry to say it appears to be emphysema.
Oh, really? I thought it was just my asthma.
Oh, really? I thought it was just my asthma.
Well, you've had asthma for years, but this is an entirely new condition.
Well, you've had, present perfect, you've had asthma for years, but this is an entirely new condition.
Can it be cured?
Unfortunately, emphysema is incurable, but there are treatments that can slow its progression.
I hope they work. I just want to be able to breathe well.
Yes, there are treatments. Unfortunately, emphysema is incurable, but there are treatments that can slow its progression. Okay, I hope they work. I just want to be able to breathe well, breathe. Well, okay, so this is what we have for the listening, and we have some, we say, issues related to language. So if you look here, so if you look at the language here today, we have, I've taken a look at, I have taken, I have felt, I have, yes, I have had it for a long time. We are going to describe, or we talk about the present perfect in a minute, but This is what we use when we use to link the past tense with the present time. So I'm talking about issues happened in the past, but it is still affecting the present time. It appears to be when you have an analysis or X-ray, so it appears to be an emphysema, it appears to be a clot or a blood clot. And then you can say, can it be cured or incured? So can it be cured? So this is what the patient has asked the doctor, can it be cured? So she's looking just hopefully to have, we say, a cure for her illness. So now today I want to give this extra grammar issue. We haven't given grammar for the last classes, but now I need this grammar because sorry, because we need to develop your skills in the grammar thing. And the grammar actually here, when we talk about the sorry, to link about two events, past and present. So the present perfect and yes. Now let's look here. So this is from the grammar book. It's chapter 5. So we have the present perfect, have done, and past simple. Sometimes when we talk about the adverbs connect the past to the present are often used with the present perfect. Don't disturb Amy. She's just gone to sleep. So if you are talking to about a person, about, let's say, if the present perfect, I just want to say something in here. If I want to talk about the present simple and past simple and present perfect, what's the difference between them? Now, if we look here about what's called the time axis, this is called time axis. So this is the present, and this is future, and this point here is the past. Sometimes when I talk about an event, of course present perfect أو ما يسمى بالمضارع التام, we don't have it in Arabic. We don't have this tense in Arabic. لا يوجد في العربية هنا. لماذا؟ في اللغة العربية عندنا فعل المضارع وفعل الأمر وفعل الماضي. So we have ماضي, مضارع, أمر. In English, no. We have past, okay, present, okay, future, and we have some area here which is called the present perfect. So the present perfect is the area here links the past with present time. كيف يعني؟ In some actions, في بعض الأفعال, when we talk about, we say experiences, شيء اسمه experiences. أي التجارب, تجربة, experiences. So when we have an experience, تجربة, for example, you traveled, سافرت, then for example, you rode a horse or you rode a camel, ركبت جمل أو ركبت حصان, مثلا يعني.
So what happened in here? The action is over. The action actually is over. يعني وقوع الفعل في الرحلة، في السفرة، لما سافرت أو لما كنت في السفر، ركبت الحصان أو ركبت الجمل أو ركبت الفيل أو طرت بطائرة شراعية مثلا، أو مثلا يعني بهذه الأشياء اللي تتذكرها دائما. The action is over. وقع الحدث وانتهى. But we still remember. ما زلنا نذكر الحدث. فإذا present perfect has two things المضارع التام. An action happened, finished, الحدث وقع كما قلنا في الماضي, finished, over, but we still remember, ما زلنا نذكر هذه الذكرى. هل هي ذكرى سعيدة, ذكرى أليمة, محزنة؟ Action is over, but we still remember. بهذا الشكل. So this is called present perfect. كيف حنستخدمه؟ حنستخدم have or has plus past participle. وهذا أكيد أخذتوه في المدرسة، التصريف الثالث للفعل. So something happened. فإذا لما نسألك سؤال have you ever ridden a camel before? Have you ever ridden a camel before? هل سبق وأن ركبت جملاً؟ Have you ever ridden a horse before? Have you ridden a bicycle before? بشكليت أو دراجة هوائية أو حصان. Why I'm asking this? Because I'm asking about an event in the past but you still remember. طبعا نسأل عن الحاجات الغريبة ليست الحاجات العامة أو المتعودة. يعني لا نسألك مثلا نقول لك have you eaten rice before? هل أكلت الرز من قبل؟ Because rice is common. Or have you eaten couscous before? Because couscous is a normal food. Have you eaten bread before? No. يعني عارف العادة. فنسأل مثلا have you eaten sushi before? فنتكلم الآن عن السوشي اللي هو أكلة يابانية ليست من المتعود الإنسان أن يأكلها. فنقول have you. ليش؟ نخش في مجال الاكسبيرينس، التجربة. أوكي have you. فإذا المعنى الأول اللي هو تجربة وقعت وما زلنا نتذكرها. Number 2 اللي هي في present perfect something happened أيضا وقع but its effect is still there. إذا هنا عندنا شيء اللي هو وقع في المضارع ووقع لكن أثر ما زال مستمرا. الأثر ما زال مستمرا. شنو هو الأثر؟ الأثر اللي هو مثلا my mom has just finished cooking. My mom has just finished cooking. Has finished cooking. أتمت الطبخ. Yes, عملية الطبخ تمت لكن الطنجرة ما زالت ساخنة. هناك رائحة الطعام في المكان. إذا هنالك الحدث وقع وانتهى لكن أثر. أوكي. إذا هنا كما سأل في السؤال you have had asthma for a long time. You have had asthma. كان عندك الأزمة كانت وأثرها موجود. Now unfortunately you have emphysema. إذا وقعت الأزمة اللي هي هذا المرض واستمر وانتهى لكن لم ينتهي على خير بل تحول إلى شيء اللي هو emphysema. إذا you have had asthma for a while, for a long time, but now unfortunately you have emphysema. فتحول من مضارع تام you have had أزمة انتهت الأزمة ووقعت أثرها ما زال موجود. الأثر تحول إلى مرض عضال اللي هو chronic disease أو مزمن. emphysema you have emphysema now. فلاحظوا التحول ما بين المضارع ويتحول المضارع التام إلى مضارع بسيط. now حنجي بعض الأسئلة البسيطة هنا نشرح هذا الشيء. حنستخدم معهم adverbs of time. adverbs of time للتأكيد هي ظروف زمانية. يعني مثلا I have seen أحمد. I have seen أحمد. كيف شفت أحمد؟ للتأكيد حنقول I have just seen أحمد. I have just معناها من فترة قصيرة. مثلا تسأل المريض have you done, have you taken or have you done blood analysis? Have you done or have you taken a blood analysis? حيقول لك البيشنت yes I have. I have just done a blood analysis. I have just أي منذ فترة بسيطة. كيف قمت بتحليل الدم؟ I have just. وعندنا شيء آخر اللي هو already و since و still و up to now و yet. هذه كلها حنستخدمها في هذه الجمل اللي راح تأتي تباعا. فقط لشرح المعنى. مثلا Don't disturb Amy, she's just gone to sleep. She has just ذهبت منذ فترة بسيطة للنوم. شنو معناها؟ هي ذهبت للنوم صح، لكن لسه ليها فترة قليلة، فربطنا الماضي بالمضارع. Have you seen Robert lately? Have you seen Robert lately يعني من مدة أو قريبا. Other time adverbs like this include already, since, last week, so far, still, up to now, and yet. When we use adverbs that talk about finished periods of time, we use the past simple rather than the present perfect. مرات عندنا أفعال لا نحتاج فيها إلى المضارع التام. لماذا؟ ببساطة لأنه وقع الفعل وانتهى الفعل. For example, Mary died at the age of 86 in 1946. إذن هنا توفت هذه اللي اسمها ماري في عام 64 1964. فهذا الحدث وقع وانتهى خلص، يعني حدث، أي شيء حدث. فلا يوجد هناك معنى أحتاج أن أنقل الماضي إلى المضارع أن ننقله، لكن الحدث وقع منذ مدة طويلة، منذ أكثر من 50 عام، 55 عام، 56 عام. فإذا هنا أحتاج إلى فقط الماضي البسيط. Mary died. Okay. War finished in 1945. The Second World War finished in 1945. الحرب العالمية الثانية انتهت في 45. خلاص انتهت. That's it. We finished and over. Okay. عندي هنا بعض الأشياء تستخدم other time adverbs like this include a month ago, at 3 o'clock last week, on Monday, once, at some time in the past, then yesterday. إذا عندي هنا بعض الظروف الزمانية تحدد استخدام الماضي. مثلا هنقول مثلا I saw Ahmed 3 months ago. I saw Ahmed a month ago. A month ago قبل شهر. I saw Ahmed at 6 a.m. this morning. I saw Ahmed at 6 a.m. this morning. احنا الآن في الصباح، لسه في الصباح، لكن 6 a.m. ساعة 6 تصبح في الماضي. إذن I saw him at 6 a.m. this morning. I saw Ahmed last week. I saw Ahmed last Monday. I saw Ahmed last month. إذن last week, last month, last Monday. Or I saw Ahmed on Monday. طبعا نقول on Monday. Today is Saturday. فإذا Monday راح يكون في الماضي. I saw Ahmed once in the past or once last month. شفته مرة الشهر الماضي. إذا once, twice, 2 times إلى آخره. Then and yesterday أيضا I saw him then. شفته في ذاك الوقت أو في ذاك الزمن. I saw him yesterday. فإذا عندما نحدد الزمن في الماضي حيكون ماضي بسيط فقط. With present perfect, with past simple فقط. هذه اللي حشرحها الآن اللي هي for example with the present perfect. And we see why الجملة هذه why لماذا هذه الجملة أخذت مضارع تام ولماذا الجملة الثانية أخذت ماضي بسيط. مجرد ما نعرف الفرق خلاص لن يكون هناك خبط أو لخبطة أو خلط ما بين الاثنين. Nothing like this has happened before. Nothing. أنت طبيب أو طبيبة وخشيت وشفت حالة غريبة، حالة طبية غريبة أو عجيبة أو لم تمر عليك في الدراسة أو عليك في الدراسة أو في الحالات، فتعتبر تجربة جديدة. فحنقول nothing like this has happened before. لم تحصل إنه حالة بهذا الشكل، إنه يكون مريض عنده حالة مرضية معينة، مريض عنده حالة غريبة المفروض يكون فيها شيء، فهذا سبحان الله. فthis is what إحدى يعني في الطب يقول إنه هذا الحالة مثلا إنه هذا المريض حالته ميؤوسة مثلا، وهذا المريض حالته خطيرة، لكن الواقع شيء آخر. فتقول I have never seen this before. I have never seen this before. لم أشاهد مثل هذه الحالة قبل. يعني خشت في التجربة الآن. أوكي. Yes, we've had the dishwasher for 3 years. We've had the dishwasher for 3 years. يتكلم عن غسالة الصحون، يتكلم عليها عن شنو؟ باعتبارها كانت تعمل وتشتغل، لكن ما زالت تعمل وتشتغل لحد الآن. إذن we've had the dishwasher for 3 years. We have it, still got it. يعني احنا اشتريناها وبتشتغل وقاعدة لحد الآن معنا. الجملة الثالثة: A new school has recently opened in our street. A new school has recently opened in our neighborhood. في مجمعنا، في حينا، في سكننا. A new school has recently opened in New Road, in Umar al-Mukhtar Street. So here I'm giving a new لأنها مدرسة جديدة، فمعناها كيف تم افتتاحها، الحدث كيف وقع. معناها فتحت المدرسة لكن تأثيرها لسه موجود. إذن هنا أستطيع أن أربط الماضي بالمضارع. الجمل في الماضي البسيط. أوكي، الماضي البسيط. Why didn't you ask me before? Why didn't you ask me before? تسأل أنت المريض مثلا Why didn't you come before? مثلا this lady with the emphysema كان عندها حالة emphysema لأنه تأخرت، الأزمة تحولت إلى emphysema لم يتم معالجتها، فتسألها أنت Why didn't you come before? شنو اللي منعك تجين قبل مدة؟ لماذا هنا past؟ لأنه أتكلم عن الماضي حصرا. We have the car for 6 years. We had the car. لما أتكلم عن شيء we had the car, we had the house, we had the money 1 year ago or 6 years ago. معناها كان عندي لكن ليس الآن. We had the car. We had we say the Kia car 6 years ago. كان عندنا سيارة كيا قبل 6 سنوات. معناها not anymore. فإذا في الماضي وقع وانتهى الفعل، ليس له علاقة في المضارع في الحاضر. المضارع التام في الجهة الأخرى لا، وقع صح لكن تأثيره ما زال موجود. وقع صح لكن ما زلنا نتذكر. إذا وقع ونتذكر، وقع وما زال التأثير. This is present perfect. I saw Dave recently. شفت الديف من مدة. ليس هنا الوقت في الماضي مهم، لكن شفته وانتهى قبل أسبوع، قبل شهر، قبل سنة، قبل 10 ليس مهما. المهم عندي أنه وقع الحدث وانتهى. لكن عندما يكون الزمن مهم والحدث مهم، هنسألك أنا Have you seen Dave recently? Have you seen؟ شفته من مدة؟ يعني السؤال يهمني. قول Yes, I have. I have just seen him yesterday. كيف شفته أمس؟ I have seen him 3 days ago. شفته قبل 3 أيام، شفته صح لكن بعدني نتذكر. إذا وقع وتم لسه أتذكر، وقع وتم لسه الأثر موجود، مضارع تام. وقع وانتهى وليس لنا علاقة بأثر أو غيره. وقع وانتهى. الحرب العالمية انتهت في عام 45. مارك فيليبس died 10 years ago. واحد اسمه مارك فيليبس توفى قبل 10 سنين وخلص. إذا هنا بهذا الشكل نتكلم عن حدث وقع وتم، حيكون ماضي بسيط. وقع وتم لكن تأثيره أو ما زلنا نتذكر لخصوصيته، يعني خش في الاكسبيرينس في الخبرة، فحيكون present perfect. وهكذا هي اللغة. اللغة نتعامل مع الشيء الذي هو في حدث محتاج إلى أن حدوده. في تمرين بسيط put a tick correct the statements. إذن هنا Terry drove to Glasgow last week to visit her father. فعندنا جمل، فإذا كان الحدث وقع وانتهى نعطيه ماضي بسيط، أو إذا لا، إذا نحب أنه نذكر الحدث مع تأثير الحدث وما زلنا نتذكر هذا الحدث، حنغير ونستخدم مضارع تام. إذن put tick or correct to the sentences. Yes, number 1. Terry drove to Glasgow last week to visit his father. واحد اسمه Terry. drove اللي هو الماضي بتاع الفعل درايف، الفعل درايف هذه R. إذا drove to Glasgow مدينة في اسكتلندا last week to visit his father. أوكي. إذا هنا قاد السيارة وزار والده الأسبوع الماضي إلى مدينة غلاسكو. إذا وقع وانتهى الحدث وانتهينا. إذا this is a trick. I have known a woman once who had 16 cats. I have known a woman once who had 16 cats. إذا هنا واحد يتكلم عن خبرة تجربة. مرة I have known a woman عرفت امرأة once who had 16 cats. مرة كان واحدة نعرفها نتذكرها كان عندها 16 cats not 1 2 3 6 16 كان عندها 16 أو 16 قطة. Wow, this is something big. Anne Baker already did 4 radio interviews about her new book. Anne Baker فواحدة كاتبة did 4 radio interviews about her new book. قامت بعمل 4 مقابلات في الراديو على الكتاب الجديد. باعتبارها مقابلات صحفية وشخص مهم فلا نحتاج أنه وقع الحدث لكن ما زال أثره موجود. فحنقول Anne Baker has already done ونكمل 4 radio interviews. ليش؟ لأنه هذا شخص مهم ويقوم بعمل لقاءات صحفية. فاللقاء الصحفي صحيح حدث لكن الناس لسه تتذكره لسه عالق في الذاكرة. Julia felt hungry. Then she has remembered the salad in the fridge. Julia felt hungry. شعرت بالجوع جوليا. Then she remembered. لا يوجد داعي إنه نقول has remembered. شعرت بالجوع ثم ذكرت في هناك سندويتش في الثلاجة. شعرت بالجوع ثم ذكرت إنه في سلطة في الثلاجة. That's it. جاعت تذكرت. انتهى الموضوع. I'll introduce you to Dr. Davis. Have you met her before? I'll introduce you to Dr. Davis. حقدمك للدكتور. Yes. Have you met her before? شفتها من قبل؟ هل شفت هذا الشخص من قبل؟ Have you met her? إذن هنا أسألك عن تجربتك عن ذاكرتك. Have you met her? شفتها من قبل؟ بهذا الشكل. We've had enormous problems recently with ants in the kitchen. We just can't get rid of them. We have had enormous problems recently with ants in the kitchen. هذا المسكين يتكلم عن مشكلة في النمل في المطبخ. أو هي تتكلم عن مشكلة النمل. فالمشكلة معناها وقعت وما زال أثرها موجود. We just can't get rid of them. على كثر ما حاولنا لم نستطع أن نتخلص منه. إذن we've had أي المشكلة وقعت وما زال أثرها موجود. النمل ومشكلته ما زال أثرها موجود. فإذن we have had. I have talked to her yesterday about doing the work. إذن هنا كلمة yesterday راح نقول I talked. لا يوجد داعي نقول I have talked. I talked كلمتها أمس وخلص about doing the work. They still live in the small house they have bought 30 years ago. ما زالوا يعيشون في المنزل. إذن وقع الحدث وما زال أثره مستمرا. فحنقول they have still. They've still lived. They have lived or they have still lived. They have still lived in a small house. They still live. Yeah. Sorry. هذه بس الجملة. إذا لا يوجد داعي نغيرها. They still. Yes. Still هو يكفي إنه. إذا هي الجملة صحيحة. هي نفسها صحيحة. They still live. ما زالوا يعيشون. They still live. أو they are still living. ممكن نقول حتى they are still living. In the house they have bought 30 years ago. اللي اشتروه لكن ما زال تأثيره موجود. الجملة هذه ممكن تأتي بمعنى آخر. They still live in the small house they bought 30 years ago. حتى نقول هنا لا يهمني أنه اشترى وبقى أثر، لا، اشترى وانتهى، يعني أستطيع أن أقول فعل الشراء وقع وتم وخلص بهذا الشكل. Yes, you have not yet explained clearly what you want me to do. You haven't yet. إذا هذا الشخص قاعد يشرح ويقدم يشرح ويقدم، لم يفهم منا الشيء، فإذا نقول له you haven't explained yet or you haven't yet explained clearly. قاعد تتكلم ولم أفهم بالضبط ماذا تتكلم عنه. إذا you haven't yet. صح هو يتكلم لكن تأثير الكلام لم يصله لحد الآن. إذا حنستخدم مضارع تام لربط الحدثين. You haven't yet explained clearly what you want me to do. We lived in Newcastle for 3 years now and I like it a lot. فهنا يتكلم عن opinion، رأيه. opinion معناها experience. إذا هنا أحتاج إلى المضارع التام، فحنقول we have lived or تكتب بهذا الشكل we've lived أو بهذا الشكل we've lived for 3 years now in Newcastle مدينة and like it a lot. إذا خلاصة الكلام يا شباب اليوم هو we have present perfect مضارع تام يربط الماضي الحدث الماضي بالوقت الحاضر لحاجتين، يا أما experience أي حاجة وقعت كذكرى أو شيء نتذكره، وقع الحدث لكن ما زلت نتذكره، أو the action has happened but its reaction is still going on. وقع الحدث لكن تأثيره لسه موجود. مثلا هنقول we have or they have just painted the house. They have just painted. كيف تم طلاء المنزل؟ كيف تزويق المنزل؟ معناها الحدث الطلاء تم، بس لما ندخل المنزل حنشم رائحة الطلاء أو الصبغ اللي هو still. My mom has cooked or has just finished cooking. انتهت عملية الطبخ لكن رائحة الطعام ما زالت في المنزل. الطنجرة والصحون ما زالت ساخنة، معناها الوقع الحدث الطبخ انتهى لكن وعاء الطبخ ما زال ساخنا. إذا وقع لكن تأثيره ما زال مستمر. Okay, this is the end of the grammar class today. So we had 2 grammar issues. أخذنا درسين grammar في هذه الحصص في حد الآن، وهذا هم الدرسين فقط اللي حيدخلون إن شاء الله لامتحان نصفي. امتحان نصفي راح يحدد إن شاء الله من قسم ويتم عليه الإعلان بإذن الله، حيكون من 30 درجة وبعدين الامتحان النهائي من 70 درجة. الامتحان راح يكون لنهاية هذه الحصة، يعني النصفي من from unit 1 من unit 1 to unit 7 إلى لحد الوحدة السابعة، ولداخل فيه التمارين ودرسي القواعد البسيطة اللي أخذناها اللي من ضمنها اليوم present perfect. Okay, for any questions, please don't hesitate asking me or through your representatives or through my page on YouTube. Thank you for being with me, and I see you inshallah all well and in good health next week. مع السلامة.